Coronary artery disease is a condition whereby there are cholesterol plaques that are laid down in the arterial wall, so the wall of a vessel. And that can occur in the coronary artery circulation or any other circulation in the body. Risk factors include cigarette smoking, which is probably the most dangerous thing one can do, high blood pressure, type 2 diabetes mellitus, or hypertension. Believe it or not, being sedentary is a risk factor for heart disease, and that's one that's completely modifiable by changing one's behavior. Family history for heart disease is also important to consider, although that is something obviously you cannot change. One of the most important things you can do is never smoke, and if you do smoke, stop as soon as possible. And other things that are important are a very healthy diet, one that's rich in fruits and vegetables. Try to minimize red meat exposure, believe it or not, being sedentary, and that is an easily modifiable risk factor, and simply walking 30 to 45 minutes a day on 5 to 7 days a week is something that is very, very important to help reduce one's risk. They're variable, but mostly include chest discomfort, and that can manifest as tightness or burning or pressure or squeezing discomfort. Some patients have shortness of breath with exertion. Others will complain of discomfort in their arms or their back or their jaw, the lower jaw. And these symptoms typically occur with physical exertion. So if somebody comes to my office and says that they're having chest discomfort or arm or back discomfort or jaw discomfort while they're walking up their driveway, that gets my attention. Shortness of breath is also a consideration, because women will sometimes have symptoms that are not completely by the book. Sometimes they will simply say they're short-winded or very fatigued with physical activities, and that'll also get our attention. The treatment options will generally include medications for symptom relief. Those medications can include nitroglycerin. There are other medications that we use to help slow the heart rate and reduce the blood pressure. And aspirin and cholesterol medications are also very important for medical therapy. For patients who have severe coronary disease, coronary artery bypass surgery is very appropriate. If you have chest discomfort that is new or concerning to you, you definitely need to let your primary care provider know, and they can usually make a decision about whether or not you need to see a specialist, a cardiologist. The most important thing to remember is that if you are having exertional symptoms, that is an abnormal finding, and that needs to be investigated promptly.